Additionally, we would like to express our gratitude to Dr. Maria Ulfa for organizing and preparing this event, as well as to Mr. Winnie Nugroho, PhD, as a moderator. Professor Liao, welcome to Master Hospital Administration Universitas Muhammadiyah Yogyakarta. As we know, the collaboration between Universitas Muhammadiyah Yogyakarta and Asia University Taiwan was outstanding. If I'm not mistaken, in the 5 years ago, we have been visit and discuss our program with Department of Healthcare Administration Asia University to make collaboration. So we hope the collaboration will continue in the field of research or community service in health administration. Professor Liao, our student who attend right now is the fresh graduate from medical school, and then the other student who has a lot of experience as a manager and leader in hospital. They are from private and a government hospital in Indonesia. So, yeah, okay. There are two types student in our school. And then, as we know, Taiwan has widely applaud for management of pandemic. I think it's very good. And so I think it is a great opportunity for us to learn about this lecture, the topic that will you deliver about hospital service, and that is related with our course. So I hope, I expect that after this lecture, students will get better understand of hospital service management and develop an idea of a study subject, particularly for their thesis. Okay, once again, thank you very much for Professor Liao. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Okay, thank you.
Thank you, Ms. Elsa. Hi, shall we continue? And before we continue, I would like to read a brief CV of Rahul and Liao. Professor is the associate professor in Department of Healthcare Administration in Asia University. He also held, he used, the career highlight here is he used to be the visiting professor in Southeast University, China, and then consultant in China Medical University Hospital, and Deputy Secretary General in Alliance for Healthy Cities, Taiwan. Wow, okay. And committee member and long-term service network development and quality improvement project, Ministry of Health and Welfare. And then also the committee member of 3H Dynamic Project, Council of Indigenous Peoples, Executive Yuan. And if I read all of this, it would be take too long, I believe. And let's just continue this main session. And the time is yours, Professor.
Okay, thank you, everybody.
You're welcome. Thank you.
Let me share my PPT first, okay?
Okay.
Okay. I believe. Can everybody hear me?
Yes, clear.
Very good. Okay. Let's begin my today's presentation. Okay. Thank you for inviting me to have this topic, the role of the academic health system in developing and optimal health service. And I'm Hong Liao, and I'm now, as I show you, I'm now an associate professor in the Department of Healthcare Administration in Asia University, and I got my PhD in the Department of Health Policy and Management in the United States, the Johns Hopkins University. And since I have so many titles, so I will just give you two titles related to today's topic. One is I'm a Deputy Secretary General in Taiwan Alliance for Health City. It means that I'm the director of the think tank for our central government, also for our Taipei City government. And also, I'm also a consultant for China Medical University Hospital. And my specialty is health service research. To make you think, I know all the audience and I, although I spent 20 years in the United States, and I know most of the audience in your university, your first language, just like mine, is not English. So I try to slow down so everybody could understand. I will give you a conclusion first for today's topic. It will be easy for everybody. The role of academic health system in developing and the optimal health service for Indonesia. I have 6 suggestions. The first one is that the service, what do I mean by optimal health service? It should be patient-centered care with equity and quality. What do I mean by equity, but not equality? But what is the real situation in Indonesia or the other country? I will show you later, okay?
Excuse me, Professor.
Yes.
So sorry, could you please your slide to be slideshow because we cannot see your slide clearly.
Oh, you cannot see?
Yeah.
Oh, let me do it again.
Different setting, I think.
Different setting. Let me show you. Let me do it again. Sorry. Can you see my PPT right now?
Yeah.
Okay.
This is, I think this is presenter view.
Okay. Can you see my PPT right now?
I'm sorry, Professor. Can you
Yes.
right click on the display, on the PowerPoint display?
Let me stop the sharing. So what is the problem? Can you show? Let's see. Okay. Can you see right now? Can everybody see my PPT right now?
Still loading.
Wait, let me stop it. Let me do it again.
Or maybe you send the presentation to us and then we try to present it from here. Is that okay, Prof?
Okay, that's no problem. But I have so many links in my PPT. I will
Oh,
send you my
okay.
PDF. So how can I send?
Okay. Wait. You can send it to my. Are you using email? I guess
Oh.
you can.
Maybe Professor can send this the slide or PowerPoint to Ibu Woro,
Okay.
and Ibu Woro will deliver.
Okay, I will send it right now to
Yeah.
World. So.
Atau private chat.
Okay, I'm saying it. I don't know, Miss Woro, Unita, could you, yes, you have read my.
Our staff send you a private message, Professor. Maybe you can deliver the PowerPoint to us by the private message, and then we will help you to operator your presentation today.
Okay. Let's see. I can send my okay. My PPT, okay. I will send my PPT to you. Can you see my PPT right now? The screen.
I cannot see it.
You cannot see it.
Yeah.
Okay, I got it. Just wait. Sorry. Yeah.
All my PPT are totally half G, 507 megabyte. So it's so huge. The reason why I need to cut the link. So I transfer to PDF file to World so you can see.
Yeah. Okay. So now we try to. Yes. Yeah. Yeah. Okay. Yeah. Professor,
Yes.
can you see our share
Yes.
screen? Yeah.
Yes.
Okay.
Okay.
Yeah.
Okay.
Yeah,
then this is concise part. Since I have shared so many my personal experience for you, but I'm sorry, I don't know how come you cannot see my total PDF, my total PowerPoint. But right now I will show you my PDF file, okay, later on. But I'm sending my total PPT file to Woro, okay? Totally is 500 megabyte, is very large. So let's continue to our today's lecture to avoid waste many people's time, okay? Let's see the next PowerPoint, next one. Yes, I will see you a conclusion about today's topic, the role of academic health system in developing and optimal health service. My first key point is that the optimal health service should be patient-centered care with equity and quality, okay? Then, as a hospital affiliated with university, as a hospital administrator, you got to think the service, when we develop and we optimize our health service, the service itself, is it counted by volume and pricing driven service, or the service we would like to provide to our customer, is it value driven service? Okay, that's the second key point. The third one I would like to demonstrate, and the quote is by your Ministry of Research, Technology and Higher Education of the Republic of Indonesia. They claim you should be an integration model for the role of your AHS. Okay, I agree, but I modify your model into quadruple, okay, quadruple helix model, which is developed by Harvard University professor. This model could be applicable for you, for Indonesia, to develop an optimal health service. The fourth key point I would like to suggest for you is the systematic thinking, okay, including organization structure, what committee, steering committee, or incubation center developed for university, and also human resources. How about their education? How about their training? And the research, service, training, financing, etc. That's what I'm going to bring to you today's our main thinking, how to develop your integration model by systematic thinking. The systematic thinking compose three components, three factors: access, cost, quality. The fifth one is that how could I push our doctors, our nurse, our student, everyone, including teachers, professors, who are stakeholders of these models, including so-called university, the government, your original group, your religious group, and hospital. How could I push people to do it by themselves? So I suggest optimal performance appraisal, or for hospital itself, it's called accreditation. The final one is that right now in Taiwan, our hospital is transformed. We import evidence-based technology to increase our efficacy, our efficiency. Okay, that's my key point and my conclusion for today's topic. Next PowerPoint. Today's my outline is that the function and goal of health system. The second I would like to bring about is essence of healthcare delivery system. The third one will be the features and the challenge of academic health system in Indonesia. Okay. The final one is the systematic thinking of the role of academic health system in developing and the optimal health services. Next one. Let's talk about, okay, if we found out someone has health need from the left-hand side, health need, then we will bring, okay, the first one is we bring our resources. Then we have our organization or program. For example, right now, in this moment, the Ministry of Health and all level of government and other public agency, just like in Indonesia, we call it BPJS, as you know, your National Security Organizing Agency, and voluntary agency, enterprises, private market. Okay, in hospital, we have manpower. We need to recruit manpower. We need to rent or buy facility, commodity, drug, material, and we need to bring people put together. And it comes with your job, the hospital administrator job. We need planning, administration, legislation. These are management parts. And the downside will be economic support. Where is the money coming from? It's quite important. The personal, household, charity, also insurance. your BPJs and government revenue and other foreign aid, like from your religious group. And finally, the delivery of a service, primary care, prevention, treatment, secondary medical and tertiary medical service. Okay, these are the delivery service. Then we will find out our health result. This figure, I did not invent this figure. This figure is developed by WHO, World Health Organization. We will see the next one. Okay, the next one is that we would like to examine how about the people, the health of our people. Since on the left-hand side, since we have a stewardship, we have a human resources, we have information to ensure the generation of and the use of information and knowledge. We have a financing to ensure fair and sustainable financing with financial protection. And we also have a service provision to ensure adequate drug, equipment, infrastructure to improve organization management and the quality of service. That's the basic function of our hospital. But from the policy, from the goal of this, we so-called academic health system, or generally the health system, we would like to examine our health outcome through the coverage. How many people are covered? And also the quality and safety, which means the service and the quality and safe for the people. And also we like to examine the efficiency to ensure the resources are used widely. Intervention, they are relevant. And financial protection to ensure people are able to avoid impoverished health expenditure, and responsiveness by treating people with dignity and ensuring the confidentiality irrespective of who they are. These are the indicator we would like to examine to see our health outcome. That will be the function and the goals of the system. But actually, next PowerPoint. What do I mean by equity and equality? In real world, we would like to do, you can take back to see the program we implement in Indonesia. The program now we are running, is it improve equality or equity? You can see the difference. Or in reality, it's like this program help rich people, but not our poor people. These are the difference among these three. Okay, equality, everybody subsidized the same. Equity is that subsidize the people who are really needed, so anybody can get the health service they need. The third one is that reality. Okay, so next PowerPoint. We would like to move to the second one. Is called essence of healthcare delivery service system. Okay, let's move next PowerPoint. Essence. When you can see a decade ago in universal health care in Indonesia, the population coverage is only 11%. In 22 million by various schemes. Okay, a decade ago in Indonesia, you know better than I. Your financial protection is very poor because for most of people, heavy out of pocket is around 70%. The third situation is that for the poor or and the near poor people. Your social safety net for 36 million people with high cost sharing, and the rest have to pay. The poor, so it means the poor are forbidden to get sick. The reason you got to have your healthcare reform, have a national security, social security organizing agency. So this PowerPoint, it tells us that there are three things we need to notice when we talk about universal healthcare service. First one is that the population, who is covered? Who is covered? Okay, before 1995 in Taiwan, we only have 58% of the people covered by 13 different various insurance programs. After 1995, within 2 years, that means that by 1997, around 97% of our population are covered by we so-called integrative universal health service, universal health insurance. We call national health insurance in Taiwan. But right now, I believe most of people in Indonesia are covered through the BPJS. The second factor we like to point out is that how about the service? Which service are covered? In Taiwan, almost around 95 or 97% of the service are covered. In even the we so-called even we so-called the heart surgery. The heart surgery are all covered. The heart implant is also covered by our insurance. I don't know in Indonesia which service are covered. Okay, I'm talking about the financing. So the last one will be financial protection. What do people have to pay out of the pocket? Pay out of the pocket. Okay. I will give you an example in Taiwan. In Taiwan, if you go to we so-called clinic or we so-called outpatient service, all you need to do is pay for around very minimum registration fee. The registration fee is around $4. Is for around $3 to $4 US dollars. Okay, that's all you need to pay. But if you are hospitalized in the hospital, okay, you will get admission. For that kind of service, totally, you got to pay 10% of the total admission fee, 10% as a ceiling, at most 10%. How about in Indonesia? Your financial protection, is it reasonable? Is it acceptable? Okay, these are when we talk about universal health care service, population service, financial protection. Next PowerPoint. Oh, I'm sorry. It should be a film, but I'm sorry, I cannot give you the film. Okay, so we have much more time. I will give you a brief introduction of the national health insurance in Taiwan. That's a video. So I'm sorry, I cannot broadcast to you. So move to the next. Sorry, next PowerPoint. Okay, but when we talk about when we talk about the health system, it should be like a not triangle. I call it pentagonal relationship of healthcare delivery system. We have on the left down hand side is insured. We call it insured or consumer. It means that you are covered by your BPJS. Okay, our customer, they pay for their premium to insure, which means that BPJS, in Indonesia. In Taiwan, we call it National Health Insurance Agency. Okay, then your employer, if you have a job, your employer will pay part of your premium also to BPJS. Then how about, but those premium collected by BPJS, is it enough to pay for our healthcare provider? Meaning the hospital is not enough. It only covers around 40%, only 40%. That means that every $100 pay for hospital, then only 40% is coming from the premium we submitted, okay? The remaining 30% is from the employer. And the final 30% is coming from the subsidy of the general tax. The general tax, of course, is from the government. Then the government in United States, okay, or in Taiwan, you need to have a policy to monitor the quality of healthcare provider, meaning the clinic, the hospital, okay. The reason why I call it the pentagonal relationship of healthcare delivery system, okay. But in Taiwan, our national health insurance system, system is supervised. It is part of the government right now, just like in Indonesia, the same. So it should not be the pentagonal. It should be the quadro. It should be a quadro, only for quadro relationship among this we so-called healthcare delivery system. When we have a healthcare need, we go to clinic. We go to clinic, or we can directly go to the hospital. In Taiwan, people in Taiwan have absolute freedom of choice. You can either go to Taiwan, you can either go to the small clinic or go to the bigger hospital, the health center, your university affiliate hospital. Okay, fine. Okay, the reason why in Taiwan, our referral system is failing. Our referral system is failing. It's not successful. Why? Because if you directly, even you have a small code, you go to bigger hospital, it will waste some money for those codes. But as a consumer, I don't know. I just feel I'm not feeling okay. So if you go to the hospital directly, you will pay higher. We will pay higher registration fee. But with the free referral system, you can go to the clinic first, and refer to the bigger hospital. Then you don't need to pay registration fee. Okay, but the registration fee, even the bigger hospital in Taiwan right now, is only around $35 US dollars for registration fee if you directly go to the hospital to see the doctor. The price difference is not very big, so most of people, they will go to a hospital. They will go to we so-called academic hospital. They will go to teaching hospital, bigger hospital. Okay, that's our failure in Taiwan. I believe Indonesia doing this is better. But how about in Indonesia problem? First of all, I believe is the access, also the quality issue. Okay, let's move the next PowerPoint. Since you in this system, but we need to, as a graduate student, you got to see the essence of healthcare delivery system. You can see the blue circle. You can see the blue circle in this figure. In this blue circle, this is the first model that I learned in the United States, okay, which is access, cost, and quality. Those three components, you got to have a balance. That's the key. Later on, I will show you when we are talking about developing and the optimal health service in Indonesia, we need to always think about the access, the cost, the quality. Then you can see in this PowerPoint, I modified this PowerPoint into, you can see the yellow part. The yellow part with a legitimacy, equity, necessity, efficiency, effectiveness, appropriateness, which are the key point we need to talk about, we need to think about when we talk about this, the balance between these three components, access, cost, and quality. I give you an example. A decade ago in Indonesia, we have only 11% of the people covered by various schemes of insurance program, right? Then if we want to expand our insurance program to cover more Indonesian people from 11% to maybe right now is 60, 70, 80%, then we solve the access problem, right? Bring people to cover by the insurance, by the BPJS. But from the viewpoint of your current situation, the budget is going up and up every year. You have more health deficit right now. Maybe the ruby is around 30.5 trillion ruby, okay, Indonesian dollars, okay? Then when you solve the access problem, the cost problem will moving up, will emerge, will come up. But how about quality? As a hospital, in the past, only 11 of the people will choose come to hospital to seek their health care. But right now, it's 60%, 70% of people crowd in the hospital. But the time is limited. So for each physician or each doctor, within 1 hour in the past, maybe see 10, maybe in hour, you can see 10 patients in the past. But right now, you need to see 20 patients, 100 patients, 120 patients. Every patient for a doctor, you could only see him for only 2 minutes, 1 minute. So the quality will be influenced, yes. So the reason why I said balance, this model will tell you when we think about develop an optimal service, we are not only see one point, we need to see it with a systematic thinking about the whole thing, okay? How about legitimacy? If we want to have people, Indonesian people have more access, we got to have a law and a regulation. That's the key point. Okay, let's talk about the equity issue in this PowerPoint. You can see the equity issue connect to access and quality. I'll give you an example. A decade ago in Indonesia, different people covered by different insurance. So they maybe have a same access, or maybe not, they may not be the same access. Okay. Also, since the different insurance program for different people, So the doctors, let's prescribe different kind of drugs, different kind of medicine to different people with different insurance program. They involve the equity issue, right? How about the necessity issue? At this point, it will connect the access and the cost. For example, right now in Indonesia, just like in Taiwan, we have you have a lot of preventive vaccine to inoculation. For example, right now, the COVID-19, of course, the COVID-19 is public. So everyone, if you can access to the COVID-19 vaccine, it doesn't matter Moderna or maybe AZ. So you have full access. But how about the cost? The cost will be the issue. How about some vaccine? Some vaccine is paid not by the public. Maybe the people, when they got to have an injection of some vaccine, you need to pay partially by out of their pocket. It will involve the cost issue. So you can see the necessity of the public size of a vaccine could be a research topic for your graduate student. Then how about the effectiveness? It will involve the quality and the cost issue. For example, if in a hospital, you would like to import a technology, a new machine. Wow, it costs a lot. But how about the maybe high cost machine will bring up the quality issue. But how about the effectiveness? If this machine, okay, MRI, for example, this MRI machine, is it very precise? It brings up the quality, but the cost also costs a lot. So as a hospital administrator, we need to think about the effectiveness when we have this kind of the MRI machine investment. Okay, so this figure, okay, this point, it brings up us the issue about access, cost, quality issue. Those are the three. They will connect together. The reason why we need to balance it. When we solve the access problem, then the cost issue come up. The quality issue come up. When we solve the cost issue, then the access and quality problem will come up. When we solve the quality issue, the access and cost problem will come up. We need to think about it. It's a balance among these three. Okay, next PowerPoint. Next PowerPoint. Okay, we will move to the feature and challenge of academic health system in Indonesia. Okay, next PowerPoint. Next PowerPoint. Next PowerPoint, please. Okay, these are the PowerPoint I borrowed from your Ministry of Research, Technology, and Higher Education of the Republic of Indonesia. You will see the definition of academic health system. Okay, it's an organizational network that consists of the medical and health facilities, teaching hospital, research, institute, private sectors, and local government that become part of our health education system. Integration to provide the best health outcome to society through health education and the translational research that will impact to the continuous quality improvement for healthcare. So the mission, I don't want to repeat it. You can see they have their mission. Okay. The first mission will be implementing excellent healthcare through evidence-based innovation. Okay, these are your definition and your mission statement. Okay, next PowerPoint. Then I will remind you the function of the function as well as the philosophy of the academic health system from higher education perspective, trilemma of higher education. Okay, as a hospital affiliated with academic health system, you have an educational function. You need to do the service function, as well as you need to serve the community or provide health service. That's a three function you need to prevent. For example, the education will be providing standardized education facility that accommodate development of science, technology, and education in order to fulfill the need of health service. Also, as a hospital administrator or a doctor or any stakeholder in hospital, they also need to implement the translational research for science technology development aligned with the purpose to improve the quality of health outcome. Then, how about the health community service? I was heard the original mission for Indonesia academic health system is to help the primary health care service, especially for those very rural areas. As we know, in Indonesia, you have more than 7,000 islands. Do they have appropriate, optimal, or good quality of health service? Then what will be the responsibility of academic health system? I will show you my Taiwanese experience later on, okay? So those functions will be joint committee of Minister of Research, Technology, and Education, and the Minister of Health, okay? Next PowerPoint. So you have a 3-stage to move on, okay? The existing legal aspect will be the UU number 20 in 2013. Now, you begin with consensus building and the commitment among stakeholders, okay? Move to synergy and the integration phase of the education, research, health service management system, okay? Including operational guideline, organization structure, integrated recruitment, and procurement system. To move right now, you might have initiate your functional integration and your structural integration, okay? Those main stakeholders, including your central government, local government, educational institution, including right now, your university, and also the hospital, the teaching hospital, okay? Then we move to next PowerPoint. Then the academic health system model in Indonesia, right now, we so-called using the triple integration model, which developed by university like Harvard University in the United States. You can see the benchmarking in the United States. They use the university, teaching hospital, and the practice plan. They connect together. That means that most, I should say partial, not most, partial doctors, partial nurses, partial medical staff, they will also serve as a teacher. That's just like me, professor, serve in university to teach, and also cooperate with professor in various departments to do the research work. Okay, so the teaching hospital, university hospital, they will health facility for health education, but facility of medicine, other faculty in higher education institution, the research center, the laboratory, that's their job in university. But how about the local government? They have a various practice plan, industry, private sector, they have their job. So it developed 5 prospective AHS model in Indonesia. You are more familiar than I about the difference between these 5 among these 5 models. Okay, but I will tell you to have a more sophisticated, systematic thinking in the next PowerPoint. Okay, next one. Okay, so the challenge you are facing right now, according to your Ministry of Research, Technology, and Higher Education of the Republic of Indonesia, you have 4 challenges. The first one was harmonizing multiple multi-sectoral regulation to formulate robust legal aspect of AHS. The second challenge will be harmonizing organization culture among institutions. The third one challenge will be integration of organizational structure and the management system, the HR, the human resources, the finance, and procurement. The final challenge will be consensus building and the commitment from government and stakeholders to develop an AHS model for Indonesia. Okay, there are 4 challenges. How could we see this issue? How could we address this issue? I don't have a standard answer, but I bring you more sophisticated, systematic thinking in the next PowerPoint. In the next PowerPoint. Okay. And then the next one, success thinking. These are the original PowerPoint from the Harvard University. Okay, we will move from the next PowerPoint. Wow, it's quite comprehensive and sophisticated. I will explain this. I will modify. I will challenge your Ministry of Research, Technology, and Higher Education of the Republic of Indonesia. You should have we so-called quadruple. You have a quadruple, not triple model, helix model. Like a left-hand side, you have not only the university, health institution, and also government. It's not like this. I believe I use Indonesian kelompok agama, which means that you know better than I, is the religious group. The religious group in Indonesia is quite powerful, not like in Taiwan. In Taiwan, we don't have a very powerful, very powerful religious group. You are very religious. In most of Indonesia are very religious. So you have this power. You need to bring this component into your model. Okay, the reason why the first difference between my proposal to your ministry is that you should bring religious group. These are the four components. The reason why I call it quadruple, not triple. Okay, component. Then the yellow one you can see for the university, you need to contribute your research. For the health institution, you need to provide your service to your people. You need also the medical staff also need to do the research. and also the training. But the training in Taiwan right now is not responsibility of the government. It's not also the responsibility of the university right now. For example, Indonesia. How about we increase the quality service of your primary health care, especially for those very isolated island, very rural island. How do we improve their quality as well, the quality and their, those doctors serve in the primary health service, especially in those islands, okay? Not like in university hospital or teaching hospital affiliate with university. Those doctors, they are doing most of their time in research. So the training responsibility in Taiwan were by Taiwan Medical Association, okay? So you can see the left down side. I suggest Indonesian Medical Society, Indonesian Medical Association, they have many we so-called specialist associations. Under your medical association, there got to be a lot of specialist association. For example, like Indonesia Surgical Association, Indonesia OBGYN Association. They should be responsible. They have a responsibility to train those primary doctors. Okay, that's what we do in Taiwan. Then the government needed to create a friendly environment by passing some law. The reason why the government function will be legislation. Also, they have a policy. Okay, they have a policy. For example, in Taiwan, the government in these models, they have a program. The program comes from the subsidy and the financing mechanism. Okay, we have in Taiwan, we have IDS, Integrated Delivery Service Program. Okay, for those rural area. In Taiwan, we have around 63 rural area, including very remote mountains. Just like in Indonesia, you have more than 7,000 islands. How about that? They don't have enough medical resources. So the government in Taiwan, we will be the National Health Insurance Agency. In Indonesia, probably I think is a BPJS. The BPJS, I suggest, initiate an IDS program, which will be subsidize those teaching hospital, university affiliate hospital, medical center, very big, very huge hospital. They will be assigned those islands to responsible to support those primary care doctors serving in that island. Those only have one clinic or even have no clinic. Otherwise, even you have a very good universal health care insurance program, even they are covered, but they did not have a health service. It doesn't work. So the IDS program, it should be work. But for those interim training, the government should have a routine program to help all the hospital to train their intern, okay, and their medical student. That's government job. The reason why the function will be in this program, in this model will be legislation, policy, initiative, and financing function. But the things is not smooth enough. The reason why Indonesia, you need to powerful organization like your religious group, Kelompok Agama. They have a very powerful financing power. They have their belief, their mission. They can make this human health right come true. There is a reason why I use this model, this quadruple model, helix model, not the original triple model. But when you want to initiate any program, you need to develop any program, you must consider the connect effect among access, cost, quality. Those three essence you need to think about always as a graduate student or as a hospital administrator. I always think about access, cost, the quality issue. Those three issues, they are connected together. If you solve the access problem, the cost problem might come up. The quality problem might come up. Also, then in this PowerPoint, you can see the center down. I can see the information technology. I will talk about this on the next PowerPoint, okay? But we will move to the right PowerPoint. When you have a systematic thinking, we have patient-centered care. We think about the value service to our customer, to our patients. It's not counted by only volume or pricing, or maybe we try to make money. We need to think about our so-called social responsibility. The reason why I said patient-centered care, including improve health. In this point, we need to think to what level and the equity issue. So we need to back to think the access and the quality. In Taiwan, we don't have this problem because we only have just one compulsory single health insurance, only one. And every people, even foreign student coming to Taiwan, they also covered by our insurance program, our health insurance program. As long as you stay more than 6 months, you are automatically covered by our national health insurance program. And this is only insurance program. But as we know, we also have many very rich people, royal family in Indonesia. If they are not satisfied with only single insurance program, they could buy the so-called supplemental commercial insurance program to make up those service, make your service more value. Okay, the reason why I said improve health, including level and equity issue. Okay, you are rich, you can buy supplemental insurance program. Okay, then the responsiveness. Those insurance programs have a response, the basic health right of the people, also social and financial risk protection. Finally, improve efficiency. There will be, when we provide our patient-centered care, how can we improve efficiency? Okay, the efficiency is from information technology. In this systematic thinking, there's one component that might raise from your mind. That the issue will be, how can I make people do it? How can I make all staff? How can I make all students? How can I make all stakeholders to are willing to do it? That's the reason why in Taiwan, we have a performance appraisal system. Appraisal, okay, performance appraisal, meaning evaluation. In Taiwan, for example, in Asia University, we also have a university hospital. The hospital, as well as the university, all the staff, including me, I have my responsibility, including teaching, research, and also cooperate, serve for the university hospital. And every year, we have an individual evaluation for every teachers. Okay, if your performance is not good, since we are private university, we are not government-owned, a public university. If for example, if Professor Liao performance is not good for continuous 2 years, you are fired. I'm sorry, you are fired. That's a sad thing. That's a very sad for private university. So the performance appraisal is quite important. But how about for a system, for an institution like a health institution, like hospital? In Taiwan, we have 4 levels of hospital. 4 levels of hospital from we so-called medical center or university affiliate hospital, the first level. The second level, we call it regional hospital, regional hospitals. The third level, we call it, the second level, we call it district hospital, the district hospital. The third level, we call it regional hospital or area hospital. The first one, the bottom one, we call it clinic, solo practice, clinic, okay? 4 level, different 4 level hospital. They have the government should set up a regulation to give those accreditation, voluntarily accreditation for those hospitals. It doesn't matter the universal hospital, university hospital, district hospital, area hospital, or clinic. You are the accreditation system is accreditation system. The performance, the rule is set up by government. So you need to pass the accreditation, because the accreditation, the outcome of the accreditation is it will determine the money, the insurance money, the payment you got from our National Health Insurance Agency in Indonesia. We call it BPJS, okay? After you accreditate by the BPJS, then you will be oriented, you will be set up, you are in which level. We have 4 levels, 4 different levels. The reason why optimal performance appraisal is quite important to push your academic health system coming through. Okay, the final one I would like to, okay, I know my time is up, but I will give you very quick about my information technology, okay, in Taiwan. Right now, in Taiwan, we are facing the transformation. Next PowerPoint. Okay, we are moving more future hospital. We have Da Vinci. You can see what Da Vinci machine. We have a very good high-tech technology with evidence base. Collect all the data. And next PowerPoint. Okay, right now in Taiwan hospital, we are doing the pervasive, everywhere, pervasive healthcare in Taiwan, including personalized medicine, participatory medicine, preventive medicine, predictive medicine. Okay, next PowerPoint. Personalized. So yes.
Excuse me, 5 more minutes, sir.
Okay, 5 more minutes.
Yes.
The personalized medicine, in other words, we call it precision health or precision medicine. You can see in times 10 years ago, want to know our futures from those drugs, from those things we made, we customize. We call it personalized precision. We could develop, collect people data to make by their own data. Okay, next PowerPoint. Precision medicine. Okay, and we could, for those in the past, for any cancer, we only have several drugs to treat it. But right now, we have personalized precision medicine, which people are suitable for which kind of medicine. We can make it through we so-called decoding our gene. Okay, next PowerPoint. Participatory medicine, meaning Internet of Things. We are not only collecting people clinical data, but by we so-called wiring data, by wiring bracelet, things like that. We can collect their routine data, like do they smoke, their health behavior data. So we could prescribe more precise medicine for our patients. Next PowerPoint. Next PowerPoint. Okay, preventive medicine. Okay, we could encourage people to have from carrying disease to carrying their health. So encourage people to have a health habit, to collect data, to giving their exercise with some incentive, so they could pay less by doing good exercise. Okay, next PowerPoint. Predictive. We have we so-called big data analysis through the AI, through the machine learning. That's what we right now we are doing. Okay, next PowerPoint. Comes our conclusion. As I told you, the role of academic health system in developing an optimal health service for Indonesia. I have 6 suggestions and a conclusion. First one is patient-centered care with equity and quality. The second will be volume pricing-driven service versus you need to move to value-driven service. The third one will be integration model, which I suggest quadruple helix model could be applicable. We don't know. You can try it. First one will be systematic thinking about every service you provide, including organization, structure, human resources, research, service, training, financing, etc. By thinking about the balance among access, cost, and quality. The fifth one with optimal performance appraisal should be conduction. Okay, for any institution, accreditation should be introduced. The final one will be import technology to increase efficiency. There will be the role of our academic health system nowadays to develop an optimal health service. Next PowerPoint. Thank you so much. Okay, I finished my today's lecture. Thank you.
Thank you, Professor Juan. I'm sorry, it's so difficult for me to pronounce your name. What is the best way to pronounce your name?
Okay, it's okay. You can call me Professor Liao.
Oh, Professor Liao. Okay, thank you, Professor Liao. Thank you so much. It's so interesting topic, and I guess we can have 20 minutes for question and answer. Is that okay?
Yes. Of course.
Okay. I will let the audience to ask the question. Either you can ask from the text or raise hand, and then you will present your question directly. Thank you. Any question?
Yes.
Raise hand. Oh yeah, please, Mr. Heri Surata, time is yours.
Thank you, Professor Liao.
Yes.
I'm enjoying your lecture. Yeah.
Okay. Thanks.
Okay. Regarding the concept of triple helix, yeah. So far as I know, in triple helix concept is academic, business, and government. Yes. What do you think with that business?
The reason why I'm trying to point out there should be not triple helix. First of all, I suggest not triple helix model. I suggest we so-called quadruple helix model, as I show you.
Okay.
Right? The first one. The second one is that from the viewpoint as a hospital, from the viewpoint of a hospital administrator, I encourage every program or every service when the government or university ask you initiate the service, you need to think about three components: connecting, access, cost, quality. The reason those three components, and it will extend to the equity, the appropriateness, efficiency. As I give you the PPT, you will tell us, is this successful? Can we affordable? Can we initiate? The reason why I give you a more logical thinking by introducing we so-called systematic thinking about the whole thing. The reason why I cannot, since I'm not Indonesian, I cannot judge which program, which service is good, which program is bad. But I will give you a more broadly thinking about access, quality, cost, connected together to think about the whole thing.
Thank you.
Okay. Another question from Ms. Ika Octaviani Resanti. You may ask the question.
Yes.
Okay, thank you so much for the opportunity given to me. First, thank you so much for Prof. Liao for the eye-opening discussion. And here, my background is clinical students from dentistry, and I would like to ask you specifically in dentistry field. So it was really nice to hear that it needs performance appraisal because it's not a common thing. I think students tend to afraid to criticize the lecturer or something like that, but I think it's a good thing to make improvement. But the conditions in the dentistry now is it's more complicated because I'm from a private university, and there is also a private hospital, private dentistry hospital, and there's also different trade that you said that the first thing that should be the underline is patient centered, but at the reality is there's a different treatment. Patient for the dentistry students, dentistry clinical students, and patients that I can say it's like patients that come by their own, not and there's a different treatment. I want to know from your perspective about that. Are there any different in Taiwan about that? Because when we talk about the patient center, the quality for if did by the dentistry clinical students, it's different. Like the materials is different, and the treatment, the administrations, patient that come by their own prefer more like prioritized than the patient that come by the dentistry clinical students. Thank you so much, Professor.
Are you talking about the patient service or the student? The student coming from the private university as well as or from the public university. Which issue? Are you talking about the clinical student issue or the service issue?
Yeah, the service issue within the dentistry clinical students, the difference between dentistry clinical students, but in the same private hospital.
Mm-hmm. Okay. Actually, the Taiwan, there are so many foreign students in Indonesia, and there are so many students in Taiwan coming from Indonesia. You can verify what I'm saying. In Taiwan, we are more equity. As I told you, that in Taiwan, we only have one compulsory health insurance system. So it doesn't matter you are from a patient viewpoint. It doesn't matter you are rich, super rich, or you are very poor. The doctor will treat you the same because we are under the same coverage, the same insurance program. The scheme, there's no different scheme, no. So the doctor, the dentist will treat poor people or treat rich people the same treatment. It doesn't matter where their background. Or the second question, the second issue we bring about, maybe if I correct me if I'm wrong, okay, you can ask more. If a private hospital, and since in Taiwan, 80% of our hospital, including clinic, 80% of our hospital, including small clinic, just solo practice, that kind of clinic. 80% of the we so-called medical care service institution are private. Maybe it's different from mainland China or maybe different from Indonesia. Most of our hospitals are private. So when government asks the third party to do some accreditation for different hospital, doesn't matter it's from public hospital or private hospital, their accreditation standard always the same. There's no discrimination. But from a student part, long time ago, I should say that 30 years ago, when I was a clinical student, 40 years ago, I'm sorry. Right now I'm 60 years old, okay? 40 years ago.
You looks like 40. Not
you.
60. Come on, I can't believe in you.
I'm sorry. I'm
No.
60 years old.
No way.
Okay. 40 years ago, when I do some examination to decide which university I go. Right now, at that time, of course, if I'm brilliant, I pass examination, I could go to we so-called the top one. Of course, I go to the top one. National Taiwan University Hospital. It's public university. They also have a public hospital. Okay. People will choose public, students will choose public university than private university before. Why? Because public hospital, their history are longer, their reputation are higher, and most of all, when students go to the public university, they pay less tuition than private university. But for the past 20 years, the government has no more money. They are doing the shrinking to subsidize public hospital. Also, the private hospital, they will dig out. I mean, they will hire faculty from public hospital or public university like me. I will recruit by Asian university. They pay higher salary to me. So there's no difference in Taiwan. There's no difference even in treatment. If the treatment, but when as a private hospital, for example, if I'm a director of a dentistry department in hospital, there are so many interns to apply to come to my department. Which one I will choose? Superficially, we were looking forward more public university graduate than private. That's a superficial reason. But actually, I tell you, even in Indonesia, they are going to change. We are looking forward the diligent. We are the diligent. You know, diligent, very hardworking dentist student better than brilliant student, even here from public university. Okay.
Okay, thank you so much, Professor, for the explanations.
Okay.
Thank you. Interesting. Any other participant that wants to ask a question?
I wish most of people could understand what the lecture the lecture I gave you for today's 1 hour lecture. I give you my innovation, my suggestion for Indonesia people. I hope it will work for you.
Yeah, it's really good, Prof. Okay. Since there is no other question, then we will come to the end. Thank you so much, Prof. Prof. Liao.
Okay.
And of course, because we are in an online world, really, we will have a photo session to close this lecture session.
Okay.
So please, everybody, to turn on the video, and then we will have a photo session together. Let's see whether we are ready or not. Mas Edwin, sudah siap?
Yes.
Yes, okay. We will count. Big smile. Big smile. 1, 2, 3. Okay, the next screen. 1, 2, 3. Okay, I guess still another 2. Okay. 1, 2, 3. Oke, Mas Edwin, screen-nya udah cukup atau masih ada lagi?
Cukup.
Mas Edwin, cukup ya? Oke. Thank you so much. Thank you all. I really enjoy the material and make me think so much. Hopefully, with this lecture, we can have a better understanding, and we can improve the health quality care in Indonesia. Thank you so much, Prof. Hun and Liao. Thank you all for the attendee. Thank you for the MARS, Magister Administration Rumah Sakit, for the this wonderful session. Thank you for Miss Maria Ulfa, Dr. Maria Ulfa, for this wonderful setting. Thank you.
Thank you.
And have a wonderful afternoon.
Yes.
And see you next time. Assalamualaikum warahmatullahi wabarakatuh.
Okay. See you next week. Okay.
See you. Okay. Thank you so much.
Thank you, Professor Enliao. Thank you, Pak Winnie. Thank you, Welse. Thank you, Bapak Ibu.
Aku share video ya, Mbak.